Okay, good morning, guys. Welcome to the first episode of the podcast Office Hours with Dr. Ellen Derrick. I'm a double board certified surgeon in general and vascular surgery. I'm also board certified in obesity medicine. And I have started a practice called Box Bar Vascular and Box Bar Beauty, and I'm based in Seattle, Washington. So today, our first episode is going to be about lipedema. So, talking about lipedema and trying to understand it, what is lipedema? Lipedema is a fat cell disorder. Essentially, if you have lipedema and you are exposed to inflammation in your body or life, your fat cells respond abnormally. And I think a lot of times I think of atherosclerosis as a neighboring model. When patients who have atherosclerosis are stressed, or if they've smoked or anything causes inflammation, they'll get artery disease and have a stroke or a heart attack. And I think of lipedema as being similar to that. If a patient who has lipedema is exposed to stress or different environmental factors, their fat cells respond abnormally. Lipedema primarily impacts women. It's 1 in 9 women in the world have lipedema, and 98% of patients with lipedema are female. However, 2% of patients are male. Men can also have lipedema. So, men, if you have lipedema, that's just fine. You are welcome to join our community. Okay, totally. I love why haven't more people heard about lipedema and why is it so misunderstood? Well, I think the good news is social media, we're all hearing about lipedema. I love this. Patients have started the movement demanding awareness, demanding an ICD-10, demanding treatment, demanding therapy. And I am so happy to see the patients advocating. And I'm grateful that now the medical establishment is starting to catch the wave. I think that one of the big reasons why lipedema has been was silent or has been silent in the medical establishment is because it primarily impacts women. And I think that it is fair to say that women's health has not been given the research and the protocol and the awareness that men's health has done. When you look at the average diagnosis time and treatment for erectile dysfunction in this country, it's about 18 months. If you look at the average time for diagnosis and treatment to lipedema, it's anywhere from 8 to, I had a patient tell me, 61 years. So menopause on the list, female vascular disease, which we'll talk about on a different episode. But I think a huge reason why this has not been treated is because it impacts women primarily. And then the second piece is that I think the medical establishment has seen patients with disproportionate legs or disproportionate arms and simply said, you're obese. You need to diet or exercise. And those patients initially thought, okay, that's what I'll do. But then when those results didn't yield any improvement, and in fact, they had other complaints, for example, tenderness with a blood pressure cuff, or discomfort when a toddler or an animal would be on their lap. I think the medical establishments just dismissed those people as being fat. Totally inappropriate. The causes of lipedema. So we don't have a single cause right now. There is thought that this could definitely be related to connective tissue disorder, and there are factors that can cause that. Venous insufficiency is connected to this disease, and whether it's the connective tissue disorder that's the bridge, I don't know. It also behaves a lot like atherosclerosis in that when a patient is exposed to an inflammatory event, the lipedema flares and is painful. It is a multifactorial disease, and it really, I think, requires a multidisciplinary team to treat it appropriately. Okay, the earliest symptom of lipedema is questioning if you have lipedema. And in all these years taking care of my patients, one thing I've learned is that these patients knew in puberty that something was different about their body. And frequently they would see it in their mother or their grandmother or their auntie, and they would go, oh, well, I just must have legs like my family member. And that's why, in spite of, being a cross country runner and eating so incredibly healthfully so that I can fuel my sport, I have no muscle definition in my legs. Okay, you should seek an evaluation anytime you think about it. If you're worried about it, you come see me, come see somebody, get an evaluation. There's no reason to put this off. Sure. So treatment options for lipedema are multidisciplinary. And I think there is a psychological stress component, and that should always be addressed. There is very likely a venous insufficiency component that should be addressed. There are body components that are meant to deal with the trapped fluid and the impact of that. And I think those treatments should be done. Water walking is my favorite. There are metabolic factors that can be influenced, GLP-1, different supplements. And then there's always the wonderful lipedema reduction surgery. Any patient with lipedema is a candidate for lipedema reduction surgery. The question is when? When is the right time for you? And the question for us as medical surgical researchers is how do we optimize your outcome from lipedema reduction surgery? Is there a way to know an optimal time to get lipedema reduction surgery? And is there an optimal pathway to set you up for the best success and an optimal recovery program to keep your lipedema quiet for years to come? Muy importante. So, diet and exercise, nutrition, I like the word nutrition and exercise is super important. Moving your body reduces inflammation and is going to keep your bones healthy. It's also naturally going to work some of the fluid out of your legs. If you have lipedema and venous insufficiency, you have anatomic reasons why the fluid builds up. And so they won't be as smooth as someone without those problems, but moving your body is so healthy. Moving your body helps your mind. And a lot of studies talk about how the legs are really like the powerhouse for the brain. So that's important. Nutrition piece, low inflammatory food is very important. People say, what is low inflammatory food? I think the easiest way to look at it, it's going to be not processed food. Anything in a package is processed. Going out to dinner, processed. So low inflammatory food is going to be whole food. Thank you so much for joining me on my very first episode of Office Hours with Dr. Ellen Derrick. Please share this with someone you think would love to hear this message. And please follow me as we explore other things in our future Office Hours with Dr. Ellen Derrick.